So far, South Africa has reported 16 cases of Mpox, which have also resulted in 3 deaths. Efforts to curb the spread of this infectious disease are ongoing in the affected communities. We'll talk more about it with Profmed Clinical Executive Justine Lacy. Justine, good morning. A lot of concern about the increase in the numbers of infections and also concerns around more mortality or increasing mortality rates associated with the spread of the disease. I think it's useful again, and this is why we've been doing a number of interviews about Mpox, is spreading the message around the presentation of the disease and what to do if you think you might be infected. And I think it's a good place to start there. Good morning and welcome, by the way.
Good morning, Iman. Thanks for having me. Yes, I think it is very important that people are not too alarmed, but rather, as you've indicated, we need to create awareness around Mpox. So we know that it's an infectious disease caused by the virus monkeypox, but it's not as fatal as one would think. Yes, there have been 3 deaths, and it might well have been that those cases were obviously patients who possibly had chronic illness or immunocompromised conditions, which predisposed them to a severe case of Mpox, which proved fatal. But in most cases, Mpox is actually, it's preventable, and it's not as prevalent as people think it is. I think it's a fairly contained disease at the moment. The most common presenting factor is the rash that usually begins with blisters, and these can obviously start oozing, and that's why it's very important for people who are in contact with a sick individual to obviously keep their distance and avoid that skin-to-skin contact, because that's how this virus spreads.
So you would say, again, just common, sort of a common sense around, sexual intercourse, for example, around using prophylactics, using things like condoms would decrease the risk of the spread, in a similar approach that we had to HIV.
Just a correction, condoms do not actually protect against Mpox, because it's more of a skin-to-skin contact, which spreads it if the infected individual has a rash. So when it comes to intimate contact, it's important to avoid hugging, kissing, and any type of skin contact that will spread the virus from one individual to another. And very important, obviously, to correct the myth around the fact that Mpox is a sexually transmitted disease. This is in fact not the case. As I've indicated a couple of times already, it is spread through skin-to-skin contact.
I think this is so important to reinforce the point, because especially when we think about the demographic that's principally involved, and these are members of the LGBTI or LGBTIQA plus community, members have come out and said, there is a stigma associated with the spread of Mpox that they wanted to speak about and to warn the public again, so that we don't experience a kind of discrimination that was experienced during the early days of the HIV epidemic. And we'll come to that in just a moment. But I think it's important to say, as you've said, it's not about using condoms. It's not about those interventions. Any kind of contact that involves skin-to-skin contact with another person increases the risk of the spread. I just want to reiterate that and confirm if my characterization is correct.
Yes, that is correct. It's in fact an individual who's infected with Mpox is only contagious when they have the rash, and the rash is one of the more common symptoms of Mpox. So that is the main route, or rather the main way that the virus is spread.
Yeah. Well, let's just stay with this for a little, if we can, Justine. I mean, we've heard from the health minister, we've heard from various clinicians and so on. talk about the way that Mpox is spread from person to person, and predominantly what we hear in the public messaging is that it's often male to male, and this is through sexual intercourse, and therefore we see the fatalities as well in sort of the male to male community.
Yes.
But what you're telling us now is that anyone who is presenting with this and has the symptoms, those lesions and the sort of skin outbreaks, if they are in contact with anyone through hugging and kissing, then that is the way the disease is spread.
That's correct. So it's very important to eradicate any type of stigma that's developing. As you've indicated, all the fatalities were young mixed race males. And in fact, all 16 of the infected individuals who are, that have been identified in South Africa are in fact males between the ages of 23 and 43. But it is important to reiterate that Mpox does not discriminate, and that anybody can get it, irrespective of gender.
Given that that is the case, why have we not seen, and again, I speak under correction, based on the information that we do have and that has been made available so far, we're only seeing it in this demographic?
It could well be, Iman, what I indicated at the beginning of the conversation, in that it happens to be males. These individuals could be immunocompromised, and that is possibly why we've seen it in young males. But HIV and other immunocompromised conditions obviously puts those individuals at highest risk of contracting a severe form of this disease, which would then prove fatal.
So what we're hearing so far is the rash begins with a blister which oozes. Avoid skin-to-skin contact. Condoms do not prevent the spread of infection. Avoid the hugging and kissing. And you want to correct the myth that it's a sexually transmitted disease. So I think that's an important reiteration that we need to make. You've also said right at the very beginning that Mpox is preventable. Walk us through that regime again, and what people should do immediately they see that they have signs of, fever, and maybe you can again recap some of the symptoms associated with Mpox.
Yes, thank you. I did want to mention some of the other initial symptoms of Mpox that one can develop. Chills, fever, muscle aches, particularly backache seems to have come up, and then obviously enlarged lymph nodes, and those are some of the initial symptoms, and the rash being the more common symptom. In terms of preventing spread, I think very important, aside from avoiding skin-to-skin contact, and that's specifically with somebody who's got the rash, is to obviously also hand wash, which is the gold standard in preventing the spread of germs, as we know. I think lots of lessons learned through the pandemic, the COVID pandemic. And then obviously avoiding contact with infected bedding and surfaces that the sick individual may have been in contact with, and keeping just basic things like keeping utensils and the cup of the infected individual, if they're living in your home, keeping that separate from the rest of the household, and that individual should actually be isolating as well. They've indicated that the individual with Mpox is contagious from the moment the lesions or blisters develop on the skin. Most common areas are hands, feet, around the genitals, and then they actually, through the scab stage, because those blisters will turn into scabs, and they only then, that contagious period only ends once the scabs have actually fallen off. So those are just some of the basic things to avoid spread. And then, Iman, if I could just also mention, obviously, if you are the individual with the Mpox, and you know that you are infected, I think it's very important that you take measures to reduce spread by letting the people around you know that you're isolating. And obviously, if those symptoms worsen, it's very important to contact a healthcare provider so that you can actually be diagnosed. You can't assume that you've got the Mpox if you develop a rash, because we know that there are a lot of other transmittable diseases in the community that also present with a rash. So it's important to see your healthcare professional, get diagnosed so that you can get the right care.
And let's just maybe end on the note of care. We know that SAHPRA is approving certain meds that may not necessarily be available in South Africa for treatment. Just talk to us about the treatment regime and where people, once they have been diagnosed, can access treatment.
Yeah, so one should be able to go to any clinic. I mean, obviously, if you don't have a medical aid, a medical scheme, if you're not on a medical scheme. Otherwise, you can present at doctors' rooms, but obviously, everyone needs to be cautious in that from that perspective. And there is no current treatment for Mpox. The treatment is largely symptomatic control, symptom control. So what they'll do is effectively treat symptoms, bring the fever down, give you something for pain, etc., etc. It's largely a self-limiting disease, which means that you will heal on your own. But if your symptoms are getting worse, it's important to seek treatment. The more severe cases those are few and far between. But if you do have a severe case, you'll probably be hospitalized for it and isolated, and they will give you quite an expensive antiviral drug to treat you, which the World Health Organization has recommended. But that's not for everybody that's got Mpox. That's only for your more severe cases. The rest of us will, like I've said, will heal on our own after a couple of weeks.
So both preventable and curable, important sort of takeout from what you've said. Justine Lacy, thank you very much for, again, that public service update insofar as Mpox is concerned. 16 cases in South Africa now, 3 deaths reported. That was Profmed Clinical Executive Justine Lacy.